there are certain sports injuries to the hips. There are avulsion fractures, basically where the muscle will pull a piece of bone off the hip. Generally, those are treated non-operatively. Occasionally, if it pulls it off too far, you will have to go in and actually put that piece of bone back where it belongs. Hamstring injuries are probably one of the biggest things around the hip. People doing exercises too fast, without warming up, without stretching, and subsequently they will tear their hamstrings. That's very uncomfortable. In certain circumstances, if you tear it off the bone and it really retracts a long way, you do have to sew those back and put those back into the bone. The majority of them are actually torn in the muscle and you don't have to do anything. But that's a season-ending injury for a professional athlete. So their season's done if they tear a hamstring. Just getting back is quite difficult. So a lot of people think, I just tore a hamstring. Well, it's actually a much more serious injury than that and takes longer to recover. There's other entities that happen. See a lot in young people that ride bikes, run, and sort of the big buzzword nowadays is hip impingement. And you can have what's called cam impingement, which a bump forms on the thigh bone, just beneath the ball of the hip, and that actually hits up against the pelvis and causes pain and discomfort. And again, usually in hip flexion, such as people that ride bikes or run a lot. There's another type that actually is an overgrowth of the acetabulum or the socket of the hip, and that's called pincer. And that actually is where the portion of the socket is overgrown, and that actually will hit the bone and limit motion. Those particular entities at the present time can be taken care of with arthroscopy, where you go in and either take the bump off the thigh bone just below the ball, or you take the extra bone off of the acetabulum or the socket to allow more room for that hip to move. Currently, data is showing that these do have good results, but we're not showing that we're preventing arthritis or anything yet in the future. And again, those studies will need to be done over the next 5-10 years.